Thank you. Thank you for the opportunity to participate today. When we talk about today's theme of allyship, the first response from the Department of Emergency Services when we found out about the hospital closures was, if you will, to rally our troops. The silver lining, if you will, of the COVID pandemic enabled us to really strengthen our communication channels with our partners. So our EMS agency managers and our emergency department managers. So we had those lines of communication already there and open, and we just brought everybody together to say, look, this is going to be impactful. How do we address this together as a team? So those channels were there. We needed to strengthen them, and everyone came to the table, and everyone is participating in an effort to help get everyone through these struggles. So specifically for the Department of Emergency Services and our efforts in relation to the hospital closures, we are the primary provider of 911 center services in Chester County and emergency management services in Chester County. We also provide support and coordination to police, fire, and emergency medical services. I'm the emergency medical services liaison, so I'll speak specifically about emergency medical services here today. One of the first items that we wanted to address was understanding the scope of the issue. So when we heard, as the scale of the dilemma increased from one hospital closure to two, when we look at how many patients were transported by our EMS agencies to both Brandywine and Jennersville Hospital in the previous years, that number came out to over 8,000. That's a significant number. Obviously, and that's only the EMS volume to those two emergency departments. That doesn't account for the walk-in volume. Typically, a hospital is about 20% EMS volume, about 80% walk-in volume. So it skews a little bit depending on the hospital, 25% potentially, but that's generally a good number. So the first question is, where are those people going to go? Okay, they're still going to go somewhere. They're still going to call 911. They're still going to need care. We need to identify where they're going to go. So we looked at our EMS transport trends, and they seem to have leveled out currently, and it looks like round numbers, there's some daily flux there, but generally round numbers, about 80% of our EMS patients are staying in Chester County. So for that 80% of our EMS volume, about 40 to 45% of those patients are going to Penn Medicine Chester County Hospital today. About 30% of those patients are going to Mainline Health Paoli Hospital, and about 8 to 10% of those patients are going to Tower Health Phoenixville Hospital. So that leaves the balance of about 20% that are being transported outside of Chester County. And there really was no surprises there as to where that 20% would land, and that's kind of spread out between Lancaster General, Christiana Hospital, Pottstown Hospital, Tower Health Reading Hospital, and Union Hospital in Maryland. So for the folks in the southern part of the county, in the Jennersville catchment area, believe it or not, Union Hospital is arguably closer, depending on where you are. But in that area, there's, real good options in terms of closeness. Those folks are going to Union, Christiana, or Chester County Hospital, which is a significant transport time regardless. One of the other components that we also looked at was the EMS offload time, or the ER wait time, or the time it takes an ambulance to transfer care from our EMS crews fully over to the emergency department. Obviously, with an increase in volume at those other hospitals, that increases our EMS offload time, and that just creates a ripple effect throughout the entire system. So as our ambulances are waiting longer to offload their patients, the 911 calls aren't stopping. They're continuing to come in. So we have to employ what we call mutual aid. So if Coatesville's ambulance is tied up at Chester County Hospital's emergency department, if Coatesville, you're fortunate in Coatesville, Washington Hose Company staffs multiple ambulances per day, but in the event that they're all tied up and another call comes in Coatesville, then we're dispatching the next closest ambulance. So whether it be Downingtown or Keystone Valley from Parksburg, so we rely a lot more on mutual aid. So we really watched our EMS offload times. This came at a terrible time, coinciding with a COVID surge. So our emergency departments were already really full with patients. They were struggling with their own staffing issues. Their staff obviously wasn't immune to COVID as well. So we saw a significant increase in our EMS offload times. I'm happy to report that that's really leveled out and come right back down to where we'd like to see it. We looked specifically at our EMS call volume. Were there any significant spikes of people dialing 911, whether that be for any type of specific emergency or any specific location? Were the folks in Coatesville City or Callan Township calling 911 more, or the folks in Penn Township calling 911 more often? And fortunately, we didn't see those spikes materialize. Everything remained fairly level. EMS call volume seems to trickle up. You know, there's an annual increase, but we saw no significant spikes, which was a good thing. And again, it all boiled back to our regular communication with our stakeholders and identifying the data, the trends, and working with them to come up with any potential solutions or strategies. As far as the actual impact of the hospital closures on the Department of Emergency Services itself, I have to be honest and say on our department, it was fairly minimal. We stepped up our efforts to look at data and support our agencies however we could, but the real impact here is on the agencies who are the direct providers of the services. So here in Coatesville, you have Washington Hose Company, which is your EMS provider. So when you look at a normal EMS call 6 months ago where someone trips on a curb and falls and suffers an orthopedic injury, and they could be attended to, packaged, and transported up the hill to Brandywine Hospital and receive care fairly quickly. Now that same patient is transported to Chester County Hospital, Reading Hospital, Lancaster General Hospital. Patient destination is largely guided by patient choice. So as long as the patient is conscious, alert, oriented, able to make sound decisions, if they say they want to go to Chester County Hospital, that's typically where our EMS crews will transport them to. There are certainly exceptions. If you have a traumatic injury, Paoli Hospital is our county's trauma center. Reading Hospital and Lancaster General and Christiana are trauma centers as well, so there's some flux there. But generally speaking, the patients have some say. So as patients, my physician now works out of Chester County Hospital, or all my records are still with Tower Health, so I want to be transported to Reading Hospital. That's kind of how our EMS crews make that determination. What's the patient's preference in combination with the patient's presenting symptoms? So you can see now that the hospital closures have caused an increase in transport time for our EMS agencies. What used to be fairly quick runs up to Brandywine Hospital, or for example, our EMS crews in West Grove, who used to be able to run somebody pretty quickly down to Jennersville, now have to go to Christiana or Lancaster General or Chester County Hospital. So that's where the impact lies. We look at increased transport times for our EMS providers, and now with the increase in fuel, that impacts their financial piece of this with a significant increase in fuel costs. We talked about the increased out-of-service time. So the ambulance from Coatesville now driving to Chester County Hospital, once they get to Chester County Hospital, they potentially now have to wait longer to offload because of the compounding issues. So they're out of the service area here longer, which makes them rely more on mutual aid. And in some cases, they have to upstaff, or they have to add an additional unit, add additional staff, and that obviously comes at a cost to them as well. We look at the impact on our emergency departments. Obviously, there was an increase in both EMS and walk-in traffic to the remaining 3 Chester County emergency departments. They have to make space for those patients. Making space in a hospital is not something that can happen quickly. And I can tell you that our hospital partners have done everything possible to date to make as much free space as quickly as possible. They have converted offices and closets into patient care area to try to make more space for patients arriving in the emergency department. The second piece of that is they can make 10 additional patient spaces, but now they have to have somebody to staff those extra 10 spaces, which is not easy in today's employment environment. So everyone is doing everything they can in that respect, but those fixes are not quick or easy, but they are on everyone's radar, and everyone is doing everything they can to increase capacity and improve staffing. And the last point I'll touch on is The behavioral health piece, you may not equate that to emergency services, but it impacts significantly our flow in the emergency department. Typically, those behavioral health patients are kind of stuck in the ER, if you will. They most often need to be medically cleared. That's why they're in the emergency department, and that takes time. And those patients are also typically one-on-one. So each patient requires a one-on-one staff member-patient interaction. So that commits a staff member to that patient for the entire duration of that patient's stay. So one of our hospitals typically reports that every day they start the day with at least 30% of their available emergency department beds occupied by behavioral health patients. So they start the day in a deficit. So it's pretty easy to do the math. If you have a 30-bed emergency department and 10 or 12 of your emergency department beds are occupied by behavioral health patients, that has an impact on the person with the orthopedic emergency, the person with the stroke, the person with the heart attack, because there's no space or staff to accommodate that. So the ripple effect of this has been tremendous. We pledge to continue to work with our partners and our stakeholders to identify potential solutions and navigate the difficulties that we're facing. But again, unfortunately, the immediate short term, we have not yet identified any significant, easy fixes, but everyone has dealt with the difficulties as best they can. Our patients are still receiving optimal care. We're fortunate we have a resource-rich, fantastic EMS and emergency department system here in Chester County. So the level of care is still extremely high. Everyone is getting the appropriate care that they need and being transported to an appropriate facility. And at the end of the day, that's key, is taking care of everyone in our community. Thank you.
Thank you, Harry.